time. Honorable Isaac Mwaura, who's a senator, will join us later on. And also Honorable Sabina Chege, Chairperson Health Committee at the National Assembly, will be joining us in just a bit. They've just had to rush to Parliament, and then they'll join this discussion as well. We'll ask them the role of the legislature in ensuring that some of these interventions that have been put in place by the government reach the actual people who are targeted by those same interventions. But first, before any further ado, I'd like to also welcome Franklin Mkwanja, the Executive Director, Center for Multi-Party Democracy, to make his opening remarks and welcoming remarks as well. Frank.
Thank you, Trevor, and welcome participants to this very exciting discussion this afternoon. Definitely exciting because we have a very good mix of panelists drawn from the private sector, the public sector, and also in academia to look into this very critical topic at a very critical time in our country. Of course, we will also be joined by members of parliament, as Trevor have said, from both the Senate and the National Assembly that are leading critical committees. Participants will be aware that Honorable Sabina Chege is the chair of the Health Committee in the National Assembly, and the Health Committee has been very critical in discussing Parliament's response and generally informing the public policy around the interventions on COVID. And also Senator Mwaura, who's the acting chair of the Budget and Finance Committee in the Senate. And you realize that a lot of money also goes to devolved systems, and therefore health also being devolved functions will be bringing in very insightful details and conversation into this. We'll be looking forward for them joining us and a really critical conversation. Secondly, we have apologies from our chair, Senator Abshiro Halake. You all understand that the kind of business that is on the floor of our Senate this afternoon. I'm not going to the details, but he's a critical player in the Senate, and asked that I relay these apologies to fellow panelists and the participants. But if in case she gets a window of opportunity from a heavy duty on the floor of the House, and then she'll be able to join us, but please receive her apologies. I would want to quickly state that the COVID-19 pandemic is far more than a health crisis. It's a fact that we know that it is affecting societies and economies at their core. The impact is varying from country to country, from family to family, from region to region, urban to rural areas. And it will be most important that we look at how this is going to likely affect the economy of the country. And of course, when you talk about economy, looking at the poverty, the inequalities that will come with these challenges arising from the COVID-19 pandemic. And therefore, it behooves us as a multi-party democratic dialogue platform to convene such multi-sectoral engagements and not just discuss these propositions that are coming from the government, and also, what the role of the oversight, people are doing, but also helping the public to understand what are the details of these propositions that the government is putting across? What is the opinion of the experts like you? So it's really a conversation to help each other, to learn from each other and see how do we work together to ensure that we are all in a position to respond and be able to support, especially the fundamental, the vulnerable communities that require the necessary support to be able to go through this difficult time. So thank you very much, Dr. Abraham Rugo, Ms. Karen Bett, and Ms. Lynette Nyangweso for joining us at the beginning. And we look forward to having the next two panelists also joining us. Thank you very much. And participants, we look forward to engaging with you, and we'll give you an opportunity to send in your questions, and we'll purpose to have the questions sufficiently responded to. Over to you, Trevor, and wish you all a very good conversation.
Well, thank you so much, Frank. Very well said there. We'll give you a chance to ask all the questions you may have, because essentially this is a conversation around the issue of budgets and whether it is a hit or a miss. Ms. Karen, I'll start with you. Having seen what has happened, the budget is laid out there. The government says the intervention that they've done is about 172 billion shillings. The most recent being the 8-point economic stimulus program, which is worth about 53.7 billion shillings. As it stands, from where you look at it, was this